So what I'm going to be talking about today is just using the tri-planar navigation. So the three planes, the S plane, swing plane, the T plane, which is the twist plane, and then the F plane, which is the flat plane. So today we're going to be talking about the upper cervical spine. So we're talking about basically how your head sits on your cranium, your skull sits onto your neck. So it's C0, which is your skull, sitting on C1. So there's not a ton of movement there, especially with 2 out of the 3 planes. And actually we do move, you think of this as more of for tilting, for extension. So this would be the S plane. And then we do have a tiny little bit of side bending, and then we have a tiny little bit of rotation here. So another way to look at this is in terms of, this may be familiar depending on your history or what you're familiar with, but it's basically those same 3 planes. You can think of things in terms of that tilt. So this would be nodding your head, yes. So again, very small. We're not talking about big movements from the whole spine or even the whole neck. It's just your head tilting in place. That's where we get a lot of the movement there, especially for extension. So be careful if you have forward head or elevated chin, to keep that a little more tucked. We want to adjust the tilt there, or in the S plane. Okay, and then we have rotation, which this would be the twist plane, the T plane. Not a ton there, just a little bit. So again, you may need to feel this to make sure that you're just moving from there, and also you're feeling for restrictions. So not a ton there. So again, yes, a little bigger maybe, but again, maybe keep it pretty small just to make sure you're in that area. And then no. And the last one is the side bend. Now this one's really important because the way that we rotate from up here, oftentimes what happens is a combination of rotation in one direction and side bending in the opposite, whereas the rest of your spine, or most of it, is rotation, maybe side bending in the same direction. So say you're stuck in here, right? Say my C2, 3, 4, whatever, down farther are stuck. So say I'm stuck on my left side, I'm kicked back, right? So how might I compensate, right? So if I was gonna pitch me here, but now, because I'm kind of side bent, I'm kind of rotated back there, maybe side bend, I'm gonna adjust my head here, I'm gonna do something funky. So I wanna make sure that I can, maybe get the rest of my body more stable and more neutral, and then maybe either use my hands or a towel. I'm just gonna roll it up, fold it up like a gym towel here, and kind of just do that to kind of hold my, my mid cervical spine in place. And that way I can also kind of adjust here. So again, it's very small, especially if you're doing precautions. You should be moving along your head a lot. And again, I'm not pulling here very hard, but just enough where I can kind of feel yes, no, and then kind of this head bobble from side to side. Very small movements, okay? But also get a sense, if you go that way and you're already kicked back here, what you might find is that this might feed that, or this kicking back might pull and feed this. So you want to try to separate those and kind of here. And then once you do, you can do some small movements to loosen and separate, kind of get that to let go and lighten up there. Contributing muscles, the SCM muscle from your collarbone coming up behind the ear there, scalene skin kind of tension, the upper trapezius coming back from the rear there, okay? There's also another levator muscle that comes a little bit, not quite all the way up, but those are the 4 big ones that kind of contribute in that area. Then the suboccipital muscles are where it get really tight and pinch on that nerve, okay? So all those little things. So things to also think about, that's more mobility, but trying to find neutral through posture from your body. But once you get there, try to adjust your head to where you think neutral should be. And just knowing, say you're scrunched here all the time, you're probably more in the side bend here. So that's how we differentiate between the rest of your spine, which we're gonna kind of get more into rotation. So if I find neutral here, it may be more of a matter of just side bending in the opposite direction, and then naturally my head's gonna rotate in that direction there. So say I'm neutral here, now I can kind of side bend and open that up just a little bit. And then I would just be more mindful, holding it there, stabilizing. So if I'm lifting, doing different things, that I'm keeping that more neutral and stable and open, and also trying to get that to carry over so that nighttime, if you have symptoms at night or in the morning, wake up with a tight, stiff neck or other symptoms, that you're negating those things because you're training those muscles to hold that open and not get pinched, tucked, tight. And that's, that's when people start to want to crack their necks and do all this stuff. It's not necessary if you just keep that open.